So this session during Kinship Care Week, so the theme for Kinship Care Week is This is Kinship Care. So a real push to raise awareness of kinship care. So we decided that it would be hopefully helpful to just provide a brief introduction and some signposting to practice tools and resources, an introduction to relevant legislation, and time for a few questions at the end. So it's really about highlighting sort of key facts to do with kinship care, so that hopefully you've got a starting point if you're working with a kinship family or become aware of a kinship family. And we're delighted that we're joined by people from different professions, so IROs, youth workers, people working in education, as well as social workers. So thank you very much for joining us, and we will crack on. So in terms of language, so Core and BAF, we've made a sort of conscious decision that we'll use the language of kinship care. The law does refer to connected persons and family and friends carers, which we use if we need to when we're referring to the law, but otherwise we use Core and BAF as a more umbrella term because it feels much more family friendly. So we don't use the word placement. We tend to use phrases like kinship family or kinship arrangement, because that's what children and young people tell us that they prefer. We're not saying that you can't use the language of the law. So often people refer to family and friends carers and connected person. That's still relevant. It's just explaining that's why we use different terms. So just a little bit of context of the current situation nationally with kinship care. So the last few years have been really quite transformational. And there's been a lot of policy work within the government around kinship care. And I suppose one of the most significant was the first ever National Kinship Strategy, which was published in December 2023. And this was the agreed definition that has been landed on in terms of kinship care. So it is any situation in which a child is being raised in the care of a friend or family member who is not their parent. The arrangement may be temporary or longer term. So this includes, excuse me, informal kinship care, special guardianship order arrangements, child arrangement arrangements, kinship foster care, private fostering where an individual is caring for a child, and adoptive arrangements where the adopter is a family member or friend. So we're not going to go into, excuse me, a lot of detail today about these different legal statuses, but just to have that definition. And it's very important that there is now a definition, not yet a statutory legal definition, but one that everybody sort of working in the sector does understand. So alongside championing kinship care, the National Kinship Strategy, there have also been some other key documents published in recent times. So just preceding that was the Stable Homes Built on Love. And then since then, Keeping Children Safe, Helping Families Thrive, which was published in November 2024, which included the government's commitment to trial allowances for special guardians in up to 10 local authorities, which we're awaiting for the announcement pretty soon. Hopefully that application process has stopped. So hopefully we will know which 10 local authorities are having that pilot very soon. And that will be, allowances will be available to kinship carers with a special guardianship order or a child arrangement order for children, caring for children who would otherwise be in care. The new statutory guidance was published in October 2024, which replaces previous guidance from 2011, so quite outdated. And that highlights the need for each local authority to publish a kinship local offer. And that happens to be the focus of our kinship conference, which is taking place a week today. So these are the sort of the foundings and the sort of shows the government's commitment to kinship care. There's still a long way to go, but it feels like there's been an awful lot of progress in the last few years. So would just like you individually now just to spend 3 minutes. You might have a pen and paper handy, you might not, but you might have a phone that you could tap a few notes into or another laptop. So just have a think for a few minutes. So it's just to put yourself in the shoes of somebody who might be a kinship carer. Now, we don't know people's experiences in the room, so appreciate this may not be easy for everybody, but we're not going to ask you for any feedback. It's just something to do as an individual exercise. So just for a couple of minutes, don't overthink it, but think of a child in your network that you love and care about. So it could be a grandchild, a niece or nephew, a close family friend, or a sibling. Imagine that for whatever reason, they needed to come and live with you tomorrow. So you don't know that this is going to happen today, but it happens tomorrow. Have a think and write down or think about all the ways that that would have an impact on your life. So have a think about practical, work, emotional, all of that. And then thinking about the child and have the child that you have in mind, why would you want them to come and live with you? So I'm just going to stop talking for a couple of minutes and let you just have a think and do that for a moment. So it's when you say a couple of minutes and it always feels like a really long time. But um, hopefully you've had a chance to think. So the reason that we ask you just to do this is just to think about what it would be like and the things that you would need to change in your life if a child or children suddenly came to live with you unexpectedly. And the reason that we're asking you to do that is because that's the situation that many kinship carers find themselves in unexpectedly. So we would suggest for those of you that are new to kinship care that this is maybe an exercise that you can take back to your team meetings and reflect together on what you noticed in a group of people that you feel comfortable with, and thinking about the impact that it would have on you and therefore the impact that it might have on prospective kinship carers and sort of the impact that it would have on your work with a family. So to just give you a bit of context really, in terms of kinship care. So the 2021 census showed that there were 121,000 children living with people other than their parents. But the census didn't include people living in households of more than 6 people, which was due to an issue with a continuation sheet. And what we do know is that children living in kinship families and kinship arrangements might well often be living in larger households than 6 people. So the adjusted figure that has been landed on is that at least 141,000 children living in kinship arrangements. So to just put that into a bit of context, in at the same period of time that was analysed, there were around 80,000 children living in care. So of course, some of those children included in the 141,000 will be children living in care as well, but it's just a sort of an indication of the huge number of children that are living in kinship arrangements. So we also know that, as in with other children living in care, that children from Black and minority ethnic communities are overrepresented compared to the general population. Most children in kinship are living in kinship care due to parents being unable to care for them, and this may be due to a variety of reasons, including mental health issues, drug or alcohol misuse, domestic violence, children who've been abused, so physical, emotional, sexual abuse or neglect. Their parents might be in prison. There may be because of parental separation or the death of a parent. So there's a whole host of reasons why children might be living in kinship care. So the benefits of living in kinship care. So research consistently acknowledges that there are significant benefits to growing up in kinship care. And that most kinship placements are of acceptable quality or better, but a minority suggest a level of concern. But most children report positive and trusting relationships with their kinship carers. And obviously, one of the key things is that children are then able to live within their families, and in the large majority of cases, maintain relationships with other family members and within their own community. So one of the sort of identifying factors of kinship care is that it is very often unplanned and crisis driven. So as we say, it is the epitome of unplanned parenting. So it's often kinship arrangement. Somebody might be asked to look after a child in a crisis, which means that the kinship carer has little or no time to make plans. So very different to people who consider becoming adopters, foster carers, who will have given a huge amount of thought to whether that's the right path for them, whereas kinship carers are very often asked in an emergency, so no time to think about it. And their motivations are different. So they will step up because of their relationship with the child, their love for the child, or potentially a sense of duty to care for them. So it's very, very different from becoming a mainstream or applying to become a mainstream foster carer. And one of the other challenges can be that a kinship carer may have had a previous relationship or involvement with the local authority, which may not have been positive. And this can have a huge impact on the working relationship between the local authority and a prospective kinship carer. There may be anger, distrust, experiences of having social worker involvement with their own children potentially, now again in the future. And there's often sometimes a lack of information at the start of an assessment process or at the start of a child needing to be looked after by a kinship carer, which can then hamper and hinder the relationship that is formed between the local authority social worker and the kinship carer. So that's something to be borne in mind. It's important to think about individual circumstances. And kinship is complex. It doesn't fit neatly into any box. So assessments that are completed of kinship carers have to take into account the fostering regulations, the law around the SGO schedule, and there are often very short assessment timescales. So and social workers are trying to make plans for a child to keep them safe and think about the reasons why they're not able to live with their parents at the same time when there is pressure on timescales for completing an assessment. So what's really important is the focus that needs to be on what is right for the child and how the prospective kinship carer can meet their needs, including thinking about what support they may need in order to be able to care for that child. Support is often provided according to legal status, but should be provided according to need. So some of the policies that I've outlined are trying to change this, and it is an underlying principle of the national strategy and very much a focus of the development of local authorities' kinship local offers. I'm now going to hand over to Anne.
Thank you. So I'm going to briefly introduce the legal framework that underpins kinship care. The need to prioritise kinship care is enshrined in the law. So the Children Act is the underpinning kind of law that underpins a huge amount of you just go back to the last slide, thanks. Underpins a huge amount of kinship care social work practice, as well as, social work practice more broadly. And it is very clear in the Children Act in section 22C that children should be cared for by their family or friends if they can't be cared for by their parents. It's also enshrined in the Human Rights Act, Article 8, the right to family life. So it's an ethical and legal responsibility that we, as local authorities, try and prioritise children living within their extended kinship network where possible. The law also even uses the phrase give preference to living with kinship carers. So if the local authority is about to accommodate a child and bring them into foster care, they do need to give preference to kinship carers who are foster carers. I won't go into the detail of this, but then there is basically a regulation within the law, Regulation 24, that then allows you to temporarily approve a family member, a kinship carer, as a foster carer to enable then that preference to be given to that child going to live with somebody in their family. As Claire said, often it's not a linear journey for kinship families. The local authority has a duty to plan for children if we have concerns about their welfare and are considering taking them into state care. And therefore, that's known as care planning. It's a legal term. But that care planning journey often isn't linear, because at the same time as you're thinking about where a child could safely go and live, if they can't remain at home with their parents at that time, there'll be the work going on that obviously Claire's just referenced around assessing the potential kinship carer and working with the extended family to see who the child could potentially go and live with. At the same time, you're also continuing to do the work potentially with the parents, for example, to see whether or not there's interventions and support that can create sufficient change for the child to remain living at home. And often there are kind of challenges and crises on the way. So although the care plan at one stage could be that we're working towards a child returning home to their parents, there then could be a crisis and suddenly the child does need to remain, with the kinship carers. So essentially it's not linear. And the planning doesn't happen in a kind of straightforward and sort of incremental way. It's often very complex. And obviously kinship families and those children are kind of, caught in the middle of that sort of non-linear process often. And also I think it's important to sort of hold on to at this point that prospective kinship carers, when the local authority are working with them, they're already part of that family system. And it's already often quite a complex landscape. There's often quite complex family narratives, for example, kind of relationships and histories that don't necessarily conform or fit with the sort of social work processes and the law and the tasks that are being sort of asked of them. And so therefore, as kind of kinship social workers and other professionals working with kinship families, I think it's quite important that we take some of that responsibility to sort of lean into working with the family rather than always expecting families to kind of conform to the tasks and procedures that the kind of law and courts and processes are sort of expecting of them, because it's often an incredibly stressful, emotionally fraught and anxiety provoking time for everyone. And I think it's important that we do hold on to what the sort of experience of that is for kinship carers at that point. Like Claire was saying, this isn't a planned decision that they've often made. This might be a bit, difficult time in their life. And so we need to kind of give them the kind of empathy and support that they need at that time. So thinking therefore in just a little bit more detail about the law, but not going into any big detail whatsoever, but just to help you understand the different types of kinship care arrangements that Claire referenced earlier that have been set out in the definition, where they fit within the law. So kinship foster care is regulated by the care planning, placement and case review regulations, as well as fostering regulations. So it's those regulations that allow the temporary approval of potential kinship foster carers and also allow for the full approval of kinship carers as foster carers in the same way as unrelated foster carers are approved at panel. As Claire stated, there's also the special guardianship order, which is a private law order that is commonly recommended though at the end of care proceedings, which is public law. When a child is living in a kinship arrangement. It's a legal order that remains in place until the child turns 18, and it means that the special guardian who is granted the special guardianship order can exercise parental responsibility for the child to the exclusion of others. And again, there are specific sets of regulations and law that determine and outline what special guardianship orders look like, what assessment is required, and what, as I've said, special guardians can do under the exercising of their parental responsibility. There's also child arrangement orders, which are mandated by the Children Act. They're also a private law order, but they can also be, again, recommended during care proceedings. So child arrangement orders share parental responsibility between the person who has been given the child arrangement order and the parents, so they don't exercise it with overriding parental responsibility. They just share it with the parents. So often a child arrangement order might state, for example, that a child is going to live with their grandmother, but that where the parents may still be potentially quite involved in the child's life. So usually child arrangement orders can be used for potentially older children who still have a very kind of enduring and strong relationship with their parents, and where the parents will still be involved potentially on a kind of day-to-day, weekly basis in their care. Then there's also private fostering arrangements, which is not fostering with a private or independent fostering agency, but it's a private arrangement that's made between parents and a private foster carer, or sometimes a young person makes the arrangement for themselves. And that isn't, the local authority doesn't have a legal duty to assess the situation in the same way that it does for kinship foster care or special guardianship, because the arrangement was made privately. But we still have a duty to assess it, to just make sure that it's safe for the child, and then to monitor it on an ongoing basis. There's a link on the final slide to Private Fostering Awareness Day, which Coram Bath runs on, I think this year it's on the 6th of November. It's 5th. Thank you, Claire. And we'll put a link in the chat to that. But if you're interested in learning more about private fostering, we also run a similar event raising awareness about private fostering at 9 o'clock on that morning as well, which is free to everyone. Private fostering also has its own set of national minimum standards, which distinguishes it from these other types of kinship care. And then finally, there's informal kinship care, which is where families have made arrangements themselves for a child to live with somebody in their family. What distinguishes that from private fostering is very specific. It's to somebody that isn't considered a close relative. So informal kinship care could be, for example, when a child is growing up with their grandmother, just as an example, for example, a teenager who's pregnant, and then the grandmother is going to bring up that child. But it's not necessarily mandated by one of these orders. So that would be what's considered informal kinship care. And again, the local authority doesn't have a legal duty to assess that in a formal way, but it does have a duty to still support those arrangements, sometimes under the Children Act 1989, under the kind of child in need regulations, but specifically, as Claire's mentioned, the requirement on local authorities now to publish a local offer means that local authorities do need to specify now what support is available to informal kinship carers. And that may be from beyond social work. It's not necessarily just from social workers. It could be from early help, other universal health services around, but that there is a responsibility to articulate now what support is available to them. So now that we've just gone through a number of sort of scenarios, we're just going to ask you whether or not you think these mini scenarios are kinship care or not. And we've done this previously in Private Fostering Awareness Day, and it seems to work quite well. What we ask you to do is find the React button along the bottom of your screen. And if you click on the React button, you should be able to find thumbs up or thumbs down, or anything really that conveys a yes or a no. I think there's actually a tick and a cross I can now see on my reactions. So what we'd just invite you to do is I'll read out one of the mini scenarios and then just chuck a reaction out to everybody, a yes or a no, thumbs up, thumbs down, tick or cross, or something that conveys kind of yes or no. And we'll just see what people think. So a child lives with her aunt following the death of her mother. Is that kinship care or not? I think, yeah, resoundingly, everybody is saying yes, it is. And you're absolutely right. Yes, that would be considered as kinship care. That is a child living with a close relative, her aunt. So it's not private fostering. We don't know, obviously, from that very mini scenario there, whether or not that's informal or formal kinship care. For example, the aunt could have made an application for a child arrangement order or a special guardianship order, but it may just be an informal arrangement that was made between the family. And so there may not be an order in place, but therefore the aunt should be eligible for support from the local authority, regardless of legal status, and there should be support available to the child as well. A social worker has asked a child's grandmother to look after them and explains that the grandmother will be assessed as a foster carer. Is that kinship care or not? Yeah, and again, resoundingly, everybody is correct. It is a type of kinship care. So as I explained earlier, though, if the grandmother is being assessed as a foster carer, she will be being assessed specifically as a kinship foster carer. And that's when we were saying the law also refers to those as family and friends foster carers or connected foster carers. But yes, the grandmother would be therefore going through the same type of assessment as an unrelated foster carer would, but only being matched specifically to their grandchild, and then would be approved as a kinship foster carer specifically for their grandchild and not to foster other children as well. A young person goes to stay with a family friend for a couple of weeks following an argument with their parents. Kinship care or not? So quite a few people saying that's not kinship care. A couple of people saying it is. A lot more people now saying it is. More people coming back saying it's not. So a bit of a more of a mix there. So according to the definitions, that wouldn't be considered kinship care because it's essentially because it's not for a long enough period. So if it was for more than 28 days, then a young person going to stay with a family friend would then become a private fostering arrangement. But private fostering arrangements only start when the arrangement has been going on for 28 days or more. But that scenario, a young person going to stay with a family friend, is a very common scenario in private fostering. And where there's often been kind of relationship breakdown at home, and then a young person sort of makes the decision for themselves to go and live with a family friend. And that still constitutes private fostering, even if the parent themselves hasn't particularly been involved in making that arrangement. And finally, following separation, a child arrangement order has been made, which states what time a child spends with each parent. So a child arrangement order has been made. Is that kinship care or not? Most people are saying it's not. A couple of people saying it is. A few more people saying they think it is. Suddenly a lot of people saying they think it is. So even though child arrangement orders are an order that are often made in kinship care arrangements, this isn't a kinship arrangement because it's a child arrangement order that has been made specifically in relation to their parent. So if a child is living with their parent, even if a child arrangement order has been made, then that isn't kinship care because they are still in the care of their parent. So I think it can be a bit confusing if people have heard around the making of a child arrangement order, but as obviously this scenario sets out, child arrangement orders are often also the private law solution for separated parents when they can't agree where a child lives and for what duration, hence why child arrangement order has been made. So thinking about your kind of roles, some of you are health workers, some of you are teachers, some of you are youth workers, obviously some of you are student social workers or IROs, and for example, but thinking about potentially your role if you're kind of outside of the social work role and you're working with a child or a young person, how would you know that that child is potentially living in a kinship arrangement? Because what, obviously the purpose of this session is to raise awareness about kinship care, so that obviously as other professionals and in your roles, you can kind of understand potentially their differing support needs, or what your role might be in supporting them. But how would you know that it's a child living in kinship care if you haven't been told that by another professional, for example? So, for example, the child may talk about living with other family members and not really talk about their parents. They may be collected from nursery or school by someone other than their parent on a regular basis. And obviously, we know that children are collected, obviously, from school, sometimes by other people on a regular basis. But if that's kind of particular regular and you rarely see their parent, then it might be something kind of just to be curious about and kind of to explore further as to whether or not they are living with their parent or have now moved to live with somebody else. It might be someone other than a parent that brings them to health appointments, for example. They may talk about, in whatever scenario at school or nursery or in other settings, about missing their parents or missing their brothers or sisters. They may react differently to how you might expect children to react to significant festivities or celebrations, because, for example, that might be a source of sort of sadness or confusion or kind of anxiety for them. But essentially what we would say is, if you're not sure, then ask them who they live with. It's a simple enough question. Won't, will hopefully just enable a child to share their lived experience and explain to you as a significant adult in their life, whatever your role might be, who they are living with. And then that should give you the information about whether or not they are a child or young person living in kinship care. So we've mentioned often the support needs of kinship families. And so we're just going to give you now a little bit of some of the research around the support needs of kinship families, and therefore what support should be made available to them. So the support needs around education. We know that I'll quickly just explain back. Joan Hunt has researched into kinship care for a number of years as an academic, probably sort of 30 or 40 years she's been doing research into kinship care. And in 2020, the Family Rights Group commissioned her to do a sort of overview of 2 decades of research into kinship care as a sort of summary overview. So her research has been, hugely helpful in helping us all understand what the support needs are of kinship families. And so I quote from her reference from her research over the next couple of slides. So what we know is that children in kinship care are doing at least as well as children in unrelated foster care educationally, not as well as other children in the general population, but that they do have higher rates of special educational needs than the general population. And so obviously, if you are in an education setting, it is important, I think, that you know and can identify children in your education setting who are living in kinship care. And in the strategy in 2023, the government have extended the role of virtual school heads. So they've always had a role towards children in formal kinship care, but they now also have an extended role towards all children in kinship care to champion the attendance, attainment and progress of children in education. So do get in touch with your virtual school if you have a child in kinship care in your school. So research around family time, or also known as contact, shows that the majority of children in kinship care do retain contact with at least one parent, although this can reduce over time. And there was also some bright spots research into children living with kinship foster carers specifically, and that more children in kinship arrangements are happy with the amount of time that they see their parents, and they are more likely to stay in touch with parents than children in unrelated foster care. And also Joan Hunt looked into the needs for kind of respite or natural breaks from caring. And one of the studies showed that this was the highest ranked support that was needed. So that kind of those natural breaks from caring, such as things like after school clubs or holiday activities or formal respite, has been identified as quite a significant need, which is often quite difficult for many kinship families to achieve. Financial support has always been a significant source of unmet need for kinship families. If If you could just move the slide on, Claire. And we do know around the country that there's quite a lot of unmet financial need around the country. There's essentially what's described as kind of a postcode lottery for many kinship carers about whether or not they receive allowances or not. Kinship foster carers are the most likely. They're statutorily required to receive a financial allowance, but they may not receive the same as their unrelated foster carer peers. Some special guardians and child arrangement order carers will receive allowances, often means tested, not always. And informal kinship carers are unlikely to receive any type of financial allowance at all. And so, as Claire said, in recognition of the significance of this unmet support need, the government is piloting in 10 local authorities a non-means tested kinship allowance for formal kinship carers. It still won't be for informal kinship carers, but it will be for all types of formal kinship carers. We also know that housing is a significant source of support need for kinship families, with another study by Judith Harwin stating that 13% of carers are noted to have housing issues, and that's normally kind of overcrowding, the need to move to bigger accommodation but not being able to. It's often not a priority, unfortunately, for many local authority housing departments, even if there's some acknowledgement that kinship care gives them additional priority with the sort of housing crisis generally in lots of parts of the country. It can be very difficult for kinship families to move. There's often lack of financial support to enable them to move to larger rented properties, and or for kind of building renovations to kind of enable kind of attic conversions or garden rooms, for example. So obviously that can have a huge impact on the well-being of the family if they're in overcrowded or inappropriate housing. We know as well that becoming a kinship carer can impact on special guardians' own health. And again, some research notes that as high as 20% of special guardians had health issues at the point that a special guardianship order was made. And that's often because the profile of kinship carers can be older. There's a huge number of grandparent kinship carers. But conversely as well, there is also some research that shows that becoming a kinship carer can improve kinship carers' health, just because of the need to kind of maintain fitness and health to be able to care for a young child, for example. And there are also continuing sort of legal issues for kinship families in that kinship carers are not routinely provided with legal consultation or support when they're being asked to kind of make decisions about the kind of kinship carer that they want to become. So just a few kind of issues to sort of finish up around support that are just some of the key kind of principles. Kinship carers are obviously not a homogenous group, and no families are static or are the same. So obviously the support needs of kinship families will vary and change over time. And so it's important that support is kind of readily accessible as children's kind of journeys change over as they mature, and that support can be accessed as and when it's needed. Support should be based on need and not past or current legal status. As we've said before, the strategy is working towards making that a reality. But in reality, support is still often according to status, legal status. It is incredibly important, obviously, to support plan with kinship families. Cornbath have recently published a new assessment template for prospective kinship carers, which has a support plan integral to that assessment template. So we're hoping that that will support kinship families feeling more confident in knowing that their support needs will be met from the outset. But obviously there's a huge amount of existing kinship carers who won't have been assessed using that template. But it is important, therefore, that their support needs are planned in a kind of holistic and integral way. Like we've said, there is quite a sort of postcode lottery of support available to kinship families around the country. So wherever you're kind of located geographically, it's important that you try and sort of find out what is available in your local area for the kinship families in your area, because it depends. And that should be now articulated really clearly in the duty that's been placed on local authorities to publish their local offer. which should include what local authorities can provide to their kinship families, but also should include community and faith groups, the voluntary sector, and obviously not necessarily just sort of statutory social work provisions, but should also include universal services, health services. And so obviously depending on what your role is, those of you obviously in the webinar today, for example, if you're in youth services or health services, if you haven't been contacted by your kind of local kinship teams and you feel that you have got something to offer kinship families, then do reach out and make contact with your local kinship team or even your front door and ask for your details to be passed on, to articulate what it is that you feel that you can offer kinship families in your area, so that that can be written into the kinship local offer.